Okay, class, what we're talking about now is what? Breathing in and out. Breathing in and out. Inhalation and exhalation. Or inspiration and expiration. Alright, let's kind of digress a moment. Breathing is an interesting situation. It is the only thing, any vital thing I can think of in the human body where it is being controlled by skeletal muscles. It's an involuntary action, but it's being controlled by skeletal muscles, your voluntary nervous system. It is being controlled by the somatic motor nervous system instead of the autonomic. It's being controlled by skeletal muscle instead of the usual smooth muscle or cardiac muscle. Now that makes breathing very sensitive. Very, very sensitive. What do I mean by that? If you got knocked out, your heart would keep beating. Your blood vessels would keep working. Your endocrine system would keep working. Breathing's not like that. If you get knocked out too much, where that your frequency of firing of something we talked about known as the RAF, the reticular activating system, if it goes low, you'll stop breathing. Death will ensue quickly. The breathing center in the brain is very sensitive. That's what a drug overdose is. When you have a drug overdose and your reticular activating system firing frequency gets low, which we've kind of chatted about, you're going to stop breathing because it is using the voluntary nervous system, skeletal muscles. Okay. Breathing is in accordance with Boyle's law, which we talked about. An inverse relationship between pressure and volume. Basically what you're doing is expanding the chest out. When you expand the chest out, you will pull the lungs out. When you pull the lungs out, their volume gets big. The pressure of gas in there goes down. The pressure of gas in there goes down below the atmospheric pressure around you. Air rushes into the lung. When you relax, the chest muscles contract. When that occurs, that squeezes down on the lungs. When that squeezes on the lungs, the volume decreases. The decrease in volume increases the pressure above the pressure outside, and air rushes out. It's as simple as that. So with that in mind, let's just go through the mechanics. Okay. Inhalation, exhalation. Let's first name the players. Since we said skeletal muscles, let's talk on those. Okay, this muscle here is the major one, the diaphragm. The diaphragm, actually, there's a diaphragm coming from one side and the other side. It meets in the middle without being muscle. So the diaphragm meets in the middle. It's not all muscle. Here's connective tissue. This area is called the central tendon of the diaphragm. So that diaphragm is a dome-shaped muscle, but it comes, and then you have the tendon. So if that's the case, then each half of the diaphragm is called the hemidiaphragm. Each half of the diaphragm is called the hemidiaphragm. And the central tendon, if you had all muscle, you'd have trouble. Why? Because you'd be trying to send the vena cava, you'd be trying to send the aorta, you'd be trying to send the esophagus and everything to take stuff from the chest down into the abdomen through muscle. That means anytime it would contract, it'd squeeze off all those tubes. So that's why we have this central tendon. Now, each hemidiaphragm is controlled by some nerves known as the phrenic nerve. So that means you have a phrenic nerve on the right and a phrenic nerve on the left. The phrenic nerve is composed of fibers, nerve fibers from C3, C4, and C5. Okay? The phrenic nerve is the nerve that gets irritated and makes the diaphragm jump up and down, and that's what hiccups are about. That's what hiccups are about. Okay? Now, because the diaphragm is a dome-shaped muscle, and from the base to the dome is about 10 centimeters in the standard human. Remember the standard human, 70 kilograms, early 20s, male, and about 5'8", 5'9", about 10 centimeters. Since it's a dome-shaped muscle, when it contracts, it would flatten. If it flattens, then then the lungs will drop, because the lungs are sitting right on top of it. Remember, your lungs are sitting right on top of the diaphragm. See? So when it drops down, flattens, is contracted, that would drop the lungs and expand the volume. And then we're back to bringing air in with that increase in volume. Okay? The next, so the diaphragm is the main muscle. The next muscle up to bat are the intercostals. The intercostals are between the ribs. When the external intercostal contracts, it brings the rib cage up and expands the chest. When it lets go, it drops down. That's the external. The internal intercostals actually squeeze the chest down. They actually squeeze the chest down. So what I'm saying here, the muscle on the external, the muscle origin is the back of the upper rib, insertion front of rib below. Now, I kind of drew a little diagram. Okay, so this is what would happen. Here we go. Muscle of origin. What we're looking at. Okay, this is what we got. Then actually, let me change that a little bit here. The muscle on the external intercostal, origin is front of upper rib. I don't know, I'm up. Front of upper rib. Let me put that. Origin is front of upper rib. Typed it too quick. Front of upper rib, and insertion is back of rib below. That's for the external intercostal. So let's look at that there. Go back, spell back correctly. Back of rib below. Pulls chest outward for inhalation. Okay, so let's go here. Then I'm going to change that one too. So here would be front of this one, back of this one. It would pull up and out, which would expand the chest. Okay, then this one, for the internal intercostal, it's going to be the back of the upper one. It will be back of the upper one. Okay. Back of upper rib, and insertion is front of lower. So it pulls the chest inward. See how this here? That means when you contract, you would come in. When you contract, you would come in. So therefore, actions of the external intercostal would be for inhalation, and actions of the internal intercostal would be for exhalation. Okay? So that's the other one. Okay? Now, let's go here. The scalene muscles in the neck raise ribs 1 and 2, which would pull those ribs up, those scalene muscles. Okay? That's another set that's going to help. That would expand the chest. Okay? Then we've got the pectoralis minor. Let's come here. Pectoralis raises ribs 3, 4, and 5. See, scalenes did 1 and 2. Pec minor raises 3, 4, and 5. Again, expansion. Okay, so what do we have so far? Diaphragm drop. External intercostals contract to bring out. Scalenes contract to raise ribs 1 and 2. Pectoralis minor contract to raise 3, 4, and 5. And that expands that chest out. Okay? Now come here. If you are to use all those muscles. If say you stood up and you bent over. You stood up and you bent over slightly. And then you try to take the deepest breath you can take. Real deep. And you did as much as you could. Now stand up and see if you can't bring some more in. Stand up. Other words, when I say stand up, raise up, because you bent over, you're already standing up. Raise up and see if you can't bring some more air in. So I throw in the trapezius muscles that keep straightens the back. Because if you bend over slightly, you'll bring in a lot of air, but not as much as if the back is straight. So I bring in this posterior muscle too. So I throw in the diaphragm, the external intercostals, the scalenes, the pec minor, and this to expand the chest. Okay, let's go back. Now, inhalation is an active process. Inhalation is an active process. Inhalation is an active process. Exhalation is just passive, because all you have to do to exhale is just let those muscles go. If those muscles go, they will compress down the chest. The muscles I just named, if you let them go, they will compress down the chest. The only one that won't is the trapezius, because it's in the back. But the diaphragm, external intercostal, scalenes, pec minor, let them go and they'll squeeze. So inhalation is always active. Exhalation under usual circumstances is passive. Now, if I need to, and so normally, let me say this, normally your breathing in and out is you're only using the diaphragm and the external intercostals. Let me make that statement. Normally for inhalation, you're only using the diaphragm and the external intercostals. The only time you're really going to bring the scalenes and these others in is when you're needing to take a deeper breath than usual. When you're needing to take a deeper breath than usual. And we're going to talk about that. I'm just setting the anatomy up first. Now, if you need to squeeze out more air than you usually do, listen to me. If you need to squeeze out more air than you usually do, then you use the internal intercostals. Okay? How are they? Back here, front here. Up and in. Up and in. So it would compress. It would compress. The other muscles you would use, if you had to squeeze it out, would be your sit-up muscles. The rectus abdominis. Internal and external oblique muscles and so forth. And the transversus abdominis. Those particular muscles would be the ones if you really had to squeeze out a lot of air. And we're going to look at that in a moment. So we've named the muscles that play into this. Now we're going to put them in play in this next video. We're going to put them in play in this next video. Okay? So we'll close here and do it on the next video.